Welcome to my educative channel. I'm Dr. Ricardo Hoogstra. I'm plastic surgeon. I specialize in minimal invasive procedure. Today I'm in Portugal, in Oporto, in this magnificent hotel, Pestana Palace Hotel, that is World Heritage. I met here with plastic surgeons from Europe to give my presentation about my personal technique, my personal point of view of the blepharoplasty. And this is magnificent place, and it's very nice to prepare an educative presentation from here. I'm going to talk about physiological periorbital rejuvenation, but what many people call this problem eyelid ptosis, or dropping of the eyelid. Most of the persons think that this skin that fall here belong to the eyelid, and this is called upper eyelid ptosis or upper eyelid dropping, that produce this sad look. Here we can see also this one, and the procedure that is performed to improve this is this kind of resection. This kind of resection of the skin, removing the upper eyelid fat pad, and this procedure is done in the same way today. This, you can see, this is the draw of the Mayo Clinic in 2021, and this is taken from internet and is advertising like the most advanced procedure using laser technology. You can see the shield to protect the eyelid from the light energy light of the carbon dioxide laser. And this is terrible. You can see almost no skin of the eyebrow was left, and most of the eyelid skin was removed, and this extends scar pull a dropping of the eyelid tail. And this is the way the procedure is done, but this is a very wrong procedure. It's easy, it's easier than others, but it's very wrong. Also, the name of blepharoplasty is wrong, very wrong. You can see only this thin skin belongs to the eyelid, and blepharoplasty comes from the Greek, that means removing the skin of the eyelid, but all the thick skin is from the eyebrow skin. This is hair of the eyebrow, but also this skin belongs to the eyebrow. And if you resect this skin of the eyebrow, you pull down the eyebrow hair down, and what does mean? This produces more eyebrow ptosis, and this produces an acceleration of the aging process, and this means that the patient is going to look sadder, tired, and older. It's unbelievable, but this is the way that this conventional procedure produces. And my technique is revolutionary. In the future, this technique is not going to perform anymore. I'm sure of this. What always I said, the aging process of the periorbital area is more related to the eyebrow ptosis than the flaccidity of the upper eyelid skin. And this picture, I put this picture to show what I am saying. You have here the head, the body, and the tail of the eyebrow, and when Isabel Queen was young, the head was under the tail. The head is under the tail. In the aging process, the tail is very low compared with is lower than the head. And you can understand here, if you are going to resect the skin here, you are going pulling more the tail down. Maybe you remove the skin and the skin is not fold anymore, but the expression is going to be sadder, older, but without fold. And this is the aging process. The aging process produces an old, sad, and tired expression like this draw. The same produces the conventional blepharoplasty. The resection of the conventional blepharoplasty pull down the eyebrow and produce this strange, old. But you can see there are no fold here. This resection, maybe you think that improve a little, but this is not real. I receive patients all the time from all around the world like this, sad, tired, extended scar. That must do epilation here too. And this is the kind of laser blepharoplasty. They resect the skin with laser, but what I'm doing is rejuvenate the skin without damage the skin. And this is the extensive scar. And what happened is here, generally this technique resect more skin in this area, and for this reason generally the scar is wider in this area. And you can see in this young patient how the tail is in this area and the big scar. Lagophthalmos, big scars. This is 24 years old patient. It really is terrible. It's terrible this. All these patients with sad and tired and old expression come to my clinic from around the world because I have a technique to improve this damage. And this is my eyes, and most of the patients that come generally to see a plastic surgeon said, "Doctor, I come here to perform a blepharoplasty," and generally they do this. But the blepharoplasty produces the opposite, pulling down this. It's very, very simple to understand. It's so easy, and you can see all resection, no eyebrow skin, young patient. For me, it's terrible. All this procedure is terrible. I'm going to change the history of the blepharoplasty, and you can understand the Egyptian have an idea of aesthetic more sophisticated than most of the plastic surgeons have today, because for them was very important to have the tail of the eyebrow over the head of the eyebrow and over the orbital rim. This is bone, is over the orbital rim. For this reason, all these young patients produce epilation here, because the patient is when they remove hair here, the eyebrow look higher than what generally it is. You can see all these pictures, all the same. And why when the patient go to see a plastic surgeon, the plastic surgeon do not propose a forehead lift? Why they don't propose an endoscopic or pull up the eyebrow? Because generally this technique produce a big scar here to remove the skin, or the resection generally can be here, and they need to remove skin from here, or maybe over the eyebrow. And also, this is the endoscopic incision, and endoscopically, when you use the endoscopic, you do not remove the skin. The plastic do not remove the skin, but to introduce the endoscopic, they need big incisions. And also for the patient is undesirable. And you can see here the resection of the skin, the undermining, and all these techniques are done to elevate the eyebrow. And this is the technique that is coronal brow lift, and this is the technique of conventional blepharoplasty. And you can see here resection here, there, and all this scar that the patient have after a forehead lift. But since 1994, I propose another and completely technique, another and completed procedures. From here to here, I do not remove the skin. I do not left visible scars. And what I'm doing is the reposition of the eyebrow, and in this way I remove the upper eyelid fat pads, and I perform laser, carbon dioxide laser, to improve. Here you can see how I remove the upper eyelid fat pads, and this is intraoperatorily. The patient this is the product of the carbon dioxide laser action, and this is the upper eyelid fat pad that I remove. And this is the patient 7 days after the procedure. You can see have no upper eyelid fat pads, no lower eyelid fat pads, an improvement of the upper and lower eyelid skin. And you can see here no scar at all, and the improvement of the skin with carbon dioxide laser. And this technique is completely different from here. This is an old technique, but today all plastic surgeons around the world continue with this technique, because I have a long training in carbon dioxide laser, and I tighten and rejuvenate the skin of the upper eyelid without need to resect. And almost from a small incision here, I remove the upper eyelid fat pads. The difference between my technique and this technique is very clear. And the reason that in most oldest patients I have reposition of the eyebrow and the patient are happy with my technique is that I do not leave scar. I reposition of the eyebrow without leaving scar. What I'm doing is a small incision here, here, and here. If from this small incision I reposition all the eyebrow and the forehead, and the contraction of the skin is what left this in an upper position, and when the skin contract, the results are very long lasting. And then, instead of all this scar, conventional endoscopic, just I make this one small incision. I produce this, and here you have the patient after the precision, and you can see a scar here, you can see a scar here, no scar. And this is the pre and this is post with my technique. And again, reposition of the eyebrow, contraction of the frontal skin. A scar here is not visible, here is not visible, and the patient improve the way this patient look younger, happy, natural, with long last result. You can see no scar here and also no scar here. This is a stab incision, very low, and also this patient have a limitation of the view field. Many of these patients not only come to my clinic for aesthetic, they come to improve the view field. Generally at night they need to do this for seeing, and also to elevate the eyebrow. The patient have all these wrinkles, this furrow here, because it's the contraction of the forehead skin to see. Because if you start here, they can see. Then they move this and they do this, and this produce headache, and also pain of the neck. And this is a nice result. Can be better, maybe yes, but this patient have a forehead fibrosis because they work at the sun under the sun all the time. And also you can see no scar here. For the plastic surgeon, it's easier to remove skin here than elevated the eyebrow, because they perform with resection of the skin here, resection of the skin here, on a coronal lift. And this is not acceptable for the patient. This patient have without short hair, and you don't see the incision. I do not see, but this maybe is this one, and you can see a scar here, and you can see how the patient can elevate the frontal and improve the natural result. And this is Korean patient that have a limitation of the view field, and is 80 years old patient. You can see the wideness of the eye here that can show the age of the patient. This patient of the same, from here, the hairline to here, no skin resection at all, no scar at all, rejuvenation of the periorbital area skin, and reposition of the forehead. This is the future. For this reason, since my first publication in 1998, since many lectures around the world, I have the recognition of the many plastic surgeons around the world. You can see here how improved. No skin resection at all. You can think if you resect a little skin from here, you can improve all the wrinkles, all these wrinkles. It's impossible resecting a thin strip of skin improve the periorbital skin. Natural, young, beauty. Okay. all kind of flaccidity of the upper lower eyelid can be rejuvenated and tightened with carbon dioxide laser, but take many years to have the ability to do this. Now we are going in 2022 and I begin to do this in 1994. You can see this flaccidity, and this is the result. It's not a nice picture, but this the front view. You can see this nevus and this nevus here and how improved. Another patients, you can see no scar at all and how improved the quality of the skin of the periorbital. It is impossible to give a natural result with this technique. You must to think that I do not resect skin at all, just only rejuvenate the skin. In the future, the patient and the surgeon must to think about skin rejuvenation, skin tightening, instead of skin resection. The future is this: no more skin resection from here to here, no more coronal brow lift or resection of this area, big scar here. Just with 3 small stab incision I'm able to reposition this, and with the laser I'm able to tighten and improve the skin, and I remove the lower eyelid fat pad from transconjunctival incision that do not left the scar, and I'm able to remove the upper eyelid fat pad through a minimal stab incision and no sutures. This is full face laser rejuvenation, eyebrow reposition, lower and eyelid. And this is what I'm doing, and this is why patients around the world come to my clinic to perform these kind of procedures. Young patients, this patient come to my clinic from outside the country because plastic surgeon performed a conventional blepharoplasty, and the patient looked sad and tired expression, and I performed endobrow with this minimal incision here, and this is the result. The patient looked nice, happy. This is a change in the expression. With the reposition of the eyebrow and the tightening of the skin here, rejuvenation is enough. No skin resection is needed. And the patient sent me the picture from outside, and she looked nice, happy, young, beautiful, and natural. And this is in 2001, how reposition and tightening. And this another patient, it is impossible to resect skin here. You can see the furrows of the forehead to lift the eyebrow and to improve the field of the view. And you can see this is after my personal technique. Also this patient and how I change the oval, how improve all the skin of periorbital area. And all this is improved with my technique. Okay, I hope you enjoyed this presentation. I'm I'm going to continue enjoy my stay here in Oporto, in this palace of the Barroco style from the 17th century. Have a nice day.